Good morning, everybody, to Mary Center for Totten, and we want to welcome DC Health and the Deputy Mayor for Education from the District of Columbia government and the Mayor Office member. We're here today to talk about the campaign No Shots, No School, and is something that I want to appreciate that we were part of this initiative as a very important accomplishment for our community. As a pediatrician, I am 100% believer on vaccination. This is what we do every day, hundreds every day. And also as a District of Columbia professional adopted city, this is the only city where I have practiced medicine in my life. So I know the community very well. I have worked in different quadrants, not only Northeast. I work in Southeast, I work in Northwest, and I know the community very well. I want to make sure we highlight, we are very, very appreciative to be part of this initiative and this program and this campaign, as vaccines are really necessary for safety and well-being of our children. We want to make sure that we highlight that we are all here to make sure this partnership is incrementing, and every day we have more and more availability for access of our community members to vaccinate every day. We need to make sure our children get vaccinated. And why do we need children to get vaccinated? Again, vaccines save lives. Vaccines are safe. They're very effective to prevent diseases that are very serious, can be very severe. Children can be very sick. And I guarantee you that children that are vaccinated thrive at school, thrive in their life, and it's really because they were vaccinated and got these amazing tools for preventing. So we are here to make sure that we present what are we doing and with this campaign and how this partnership is so important for all of us in the community. We have from the mayor's office that no shots, not school. Kids are going to have 20 days, school days after they start the school to get vaccinated, and this is any school. Private, public, charter, parish schools need to pursue this mandate, and this campaign is here to help you to make sure this happens to the population of the community. I want to make sure that everybody remembers each vaccine matters. Each vaccine has a crucial role, and they're different. I want to remind people that we, at my age, used to get vaccines that are no longer existing for children or adults because we disappeared the disease of Earth. So it's such an important tool that it really needs to happen. And we all together, as DC members, have to make this happen. I want to add, too, that these campaigns are mainly for routine vaccines because they are approved by FDA to be routine vaccines. And I want to add that we still have the COVID vaccine that is also extremely important, but this vaccine is still as an emergency use approval. And until now, I want to make sure that's clear, but it's really extremely necessary because if you are not vaccinated with COVID, you may have the risk to lose days at school, and again, we need to recuperate days that we missed in the last 2 years because of the pandemic, right? This has been hard moments. I want to make sure this is one of the risks that we live during the last 2 years to prevent us to get vaccinated, and also some information issues, education. So this campaign will work towards making sure that we all have the right information and we all have the education and information needed to make this happen. I want to thank everybody for being here and making this happen. We have, Mary Center has been committed to the community for 34 years, and of course vaccinating children. We had been above the national standards of child vaccination or immunizations and including the last QI report that we got from our dashboard, mentioning that our vaccination rate was 79% and the national average was 40%. So we are always striving for making sure our children are vaccinated. So this, I think, is an ideal partnership with the School of the District of Columbia, making this happening so the child can thrive and be at school as much as possible and learn and continue their growth. I want to thank everybody for this opportunity. I'm going to introduce Dr. Benyali, who is the Bureau Chief of Community Health Administration, and he's going to follow me. Thank you and welcome.
Hi, I'm Asad Bandiali. As Dr. Marquez said, I'm the Bureau Chief for our Healthcare Access Bureau at DC Health, and I'm honored and humbled to be here speaking with you. For the past 2 years, in the context of the COVID pandemic, many things have been put on hold, including that is well child care and immunizations. Most kids do get their vaccinations, and most kids are up to date. However, we do need to be at 95% for many vaccines, including the MMR, to prevent infectious diseases such as measles. According to our data, which is incomplete, approximately 27% of children in the district are not up to date on routine pediatric immunizations. That's about 20% of elementary schoolers, about 1/3 of middle schoolers, and about half of high schoolers. Let's not forget the COVID vaccine, which is now FDA approved, fully approved for ages 12 and up. And that means that for children ages 12 and up in school, it is required. Among ages 12 to 15, about 87% of children have completed their primary series, and 81% of children 16 and 17. So that means about 15% of kids still have to get caught up on this immunization series. We know, and it's important to note, that our data are incomplete because many children are vaccinated outside of the district. In many cases, a child may be fully vaccinated, but we just don't have that proof. We need that proof to be able to ensure that we protect kids against outbreaks in schools. And so if you haven't been back to your primary care in a while, or you've been delaying for COVID reasons or other reasons, now is the time to go back, to get back to your medical home, to catch up on immunizations. Your family physician, your pediatrician, your healthcare provider can answer your questions about vaccines. They know your child. They can help you to address any health concerns that you may have, and they're able to complete the Universal Health Certificate or provide some other proof of immunization. And so when you do visit your pediatrician, your healthcare provider, please make sure that you get proof of that immunization and take it to your school. With that proof, you're able to demonstrate that your child is on track for their vaccines and can stay in school. Religious exemptions and HPV opt-outs do expire July 1st, and so if that applies to your family, please make sure that you visit dchealth.dc.gov/immunizations for the link to renew your exemption. There are about 57 and counting pediatric vaccine access locations across the district, and they're open weekdays, weekends, and evenings to provide service to you and your families. What we're doing a few things to kind of make it easier, because we know that your schedules are busy. You may not always be able to get an appointment when you need it. And so DC Health is working directly and indirectly with our healthcare partners to provide multiple new opportunities to get vaccinated. The first is a medical home. These are fast-track, vaccine-only appointments. You can schedule a time, though walk-ins can be accommodated, and this includes evening and weekend openings. Mary Center, who so graciously hosted this event, has added 170 vaccine-only appointments per week, every week through the end of the year, across all 3 of their health centers here in the district. Walk-ins can be accommodated, and then on Saturdays in August and September, from 9 a.m. to 12 p.m., Mary Center will be adding additional vaccine-only visits. Children's National, Tuesdays through Friday at all 5 of their Goldberg Health Centers, and select locations on Saturday will also be providing vaccine-only visits. And then Unity will be arranging walk-in vaccine clinics on Saturdays in August and September from 8 a.m. to 12 p.m. at their Anacostia, Brentwood, and Upper Cardozo locations. The second option is school-located mobile clinics. So these are coordinated by DC Health and working with schools where compliance rates are, non-compliance rates tend to be highest. And these are run by Mary Center, Unity, MedStar, Children's National. You can actually pre-register for this by visiting www.bit.ly/DC Health Mobile Unit. Sorry. If you don't get all of these, we're going to have links up everywhere, and you'll see us tweeting them. But you can actually schedule ahead of time. The third option is school-based health centers. These are open throughout the summer from now until the first day of school. And are servicing any student. You don't have to be a patient of the facility, and parents can even get their COVID vaccines there. These can also be registered, pre-registered for through our website. The final option that we're kind of layering on top of the existing system is the vaccine exchange. So if you're a school, a community-based organization, or any other similar such organization that doesn't have an event yet or feels like you need a second event, please visit request.vaccineexchange.dc.gov to put in a request, and any of the vaccine operators in the city will connect with you to schedule your event. So overall, just again, dchealth.dc.gov/immunizations. This is the best spot to go. We're going to have an up-to-date calendar. We're updating it as new events come online. So please keep checking between now and throughout the fall for opportunities to have your child immunized. So our goal is that no child should miss a single day of school. And that means that we need to get started now. And so we're out there. Since June, we've been running our media campaign. You may have seen it on bus bench ads, in print, in digital, social media. We're also going to be sending over the next week here, they're actually in the mail, 22,000 personalized letters for families of children who've been identified as missing immunizations. In August, we're going to be doing 29,000 automated phone calls. So if you get one of these letters, if you get one of these calls, please heed the message. Please take your child in to be immunized. If you get one of these letters or calls and your child is already up to date, it probably just means that we need proof of that. We need some documentation. So you can contact your healthcare provider to get documentation, and please make sure that you bring that to school ahead of the school year, or at the very least on day one of the school year. And then that way your child can stay in school. So finally, I just want to say, if we complete our homework, if we get our children immunized, we can make sure that all kids are protected by the first day of school. Thank you. And our next speaker is a family. I'm honored to present Sarai.
Thank you so much, Doctor.
Good morning. My name is Sarai Salmeron, and it is such a pleasure to be here with all of you today in the No Shots, No School announcement. I am a proud mother of 3 wonderful children, a 1-year-old, a 4-year-old, and an 8-year-old. I have to say that at times it has been a little difficult to keep vaccines up to date, especially during pandemic. And even going to the doctor's offices has been a little scary at times, just knowing that COVID is still out there. But for our family, it is really non-negotiable with vaccines. We are 100% vaccines. I have previously worked here at Mary Center and have seen at firsthand how unvaccinated children have actually come in with so many illnesses and infections. And I would hate that for my children. So today I am proud to say that my 3 kids are up to date with their vaccines and ready to just start the new school year. Thank you. Yes. And just knowing that, your kid is vaccinated and will be in an environment that is protected gives me so much, just a sense of safety to know that they'll be in an environment with every other child will have the same opportunity to do that. So thank you so much for making this happen. Thank you.
So we want to introduce Dr. Paul Kim, who's the Deputy Mayor for Education, who is also part of the members of the Mayor's office who make this happen. Thank you for being here with us. Thank you very much.
Thank you. Good afternoon. I want to start off by thanking Dr. Marquez and the team here at Mary Center for all of your hard work, for Dr. Bandayale and the full team at DC Health for the extraordinary work that you all have done to expand access in new and innovative ways to meet the needs of families as we get started on this. As Mayor Bowser emphasized in a press conference earlier this summer, DC will fully enforce the no shots, no school immunization policy this upcoming school year. And it is therefore essential that every single family include vaccines on your back to school list. My office is coordinating very closely with DC Health, health providers across the city, our entire public education cluster, including OSSI, the state superintendency, DCPS, our public charter schools, and CFSA to make sure that our public outreach is strong, it is consistent, and it is clear. For example, our state agency, OSSI, has been hosting meetings with public school leaders across the city to ensure that they can share best practice about how to do outreach effectively, how to stay in touch with families. And they are continuing to provide technical assistance to public schools as we move through the summer and into the critical first day of schools around how to implement these routine pediatric immunizations and how to ensure good compliance. We are also, at DCPS, sending a letter to all families reminding them specifically of the immunization requirements and sharing information on all of the various places they can go to get their shots. We have at DCPS and across our public charter schools been making phone calls, we've been sending emails, we've been sending out text messages, many with very specific information, because we know a lot of the hard work here is at the front line of schools, and our school communities are rising to this challenge. Continuing this on August 9th at DCPS, they'll be hosting a call-a-thon to reach out to non-English speaking families to ensure that we've mobilized volunteers and staff to answer any outstanding questions that families still have about this policy and where to go and what to do. So we really hope that families will take this opportunity now, before the first day of school, to get children vaccinated. Please make an appointment with your doctor. Come and see our friends here at Mary's Center. Go to a school-based health clinic. Visit one of DC Health's mobile clinics. Go to the website. But please, please, please make sure that you're getting your children vaccinated. Together, through this work, we can protect all of our children here in DC and make sure that not a single student misses any school because of this. So thank you for being here. And with that, I'll invite my colleagues, Dr. Farley, Dr. Bandali, to come up and join me, and I think we'll take a few questions. Nice to see you.
Good. From what I can tell, DC has, with this, with the FDA approving vaccines, fully authorizing for 12 and up, we have one of the strictest COVID vaccine requirements in the country. I can't right now think of another big school district that is requiring COVID vaccines as basis for enrollment. I'm not saying there are none. But what do you think that says that DC has one of the strictest vaccine requirements for enrollment, and what are the stakes with such a strict mandate?
Thank you for the question. And just to be clear, I think what you're referring to is the law that was passed by City Council that requires COVID vaccination in schools for any vaccine that has been fully authorized. And we know that last year we had the full authorization for the 16 and overs, and more recently, at the beginning of the summer, we got the full authorization for those 12 to 15. So in order for us to be in compliance with that law, of course, we need to ensure that we are enforcing that mandate as well. And I think what that says is that council certainly, and the folks that they represent and the residents, see the real importance of protecting our community, protecting our school communities against COVID and the coronavirus. And we, of course, have every intention of ensuring we follow that law. Not sure if anyone wants to add anything to that?
I know that did come from council, but do you think that would the city have been ready to enact such a law if it didn't come from council? Like, do you think we're there? Would the education leaders have said we're ready to, or health leaders have said we're ready to enact such a strict COVID vaccine mandate for enrollment?
Well, I wouldn't want to speculate on what we would or would not have been ready for, but certainly I think what we're demonstrating and what our colleagues at DC Health are demonstrating is that we are indeed fully ready to provide all the supports that we think families need in order to come up to date with their routine pediatric immunizations and now, of course, the COVID vaccinations. We did tremendous work led by DC Health over the past 2 years to provide access to the COVID vaccines. And we now have a very high, I would say, compliance rate with COVID vaccinations, which you heard Dr. Bandayale talk about.
Sure. And I can say we're, like as I said, we're at 85% of kids in that age range have completed their primary series. 95% have at least one shot. So there is really just a small gap to close there.
Can you speak to the racial disparities in that? I mean, what does it look if you break it down by demographic, that 85%?
Yeah, I actually don't have those numbers with me today, but we can certainly work with our media team.
One real quick question. All the vaccines that are being offered at these 50-plus locations, are those all free to everyone, like the COVID vaccines were free?
The 57 locations, 54 of them actually participate in the Vaccines for Children's program, which means that the vaccines are free, including the administration fee is free. And then basically for people that are covered by commercial insurance, their insurance pays for them, and that's part of the benefits of the Affordable Care Act, actually.
And then, Deputy Mayor, I appreciate, when you say, and I was there when the mayor said it very forcefully, that you're going to enforce this. But, longtime D.C. residents, those of us who have put kids through D.C. public schools, know in the past there's been very lax enforcement of the requirement for vaccinations pre-COVID. Why is it going to be, what makes you so certain that DCPS is able to actually enforce it effectively, as you say, this time around?
Well, I think you're right. We have gotten out of the habit of enforcing this very, very important mandate. And I think what you're hearing from us, what you've heard from the mayor, what you're hearing from me here today, is that as we're coming out of the pandemic, and as we look at the current rates of routine pediatric immunizations, we are saying that they are too low and that those numbers are not acceptable as we look to trying to ensure that all of our children, our communities, our school communities are safe from preventable illness. And that's why what you're hearing from us today, what you will continue to hear from us over the course of the summer, is that we have every intention of enforcing this, and we're putting all of the necessary pieces in place, including, as you just heard from Dr. Bandayale, dramatically expanded access to make it very, very easy for families to go and get these immunizations. And so we have every intent of doing this. We're standing up the infrastructure. We're doing all of the communication. We're training our schools. We're communicating directly with our schools. They're working with families. We're working directly with families. And so we have every intention of doing this.
Is it possible we could get some Spanish sound for Telemundo, just briefly?
Yes, absolutely.
Doctor, if you could just tell us, and I don't speak Spanish, so I'll just assume you're answering the question, but if you could just tell us again, why it's important, and speak directly to, our Latino community, particularly those people who might be worried about immigration status or insurance status and those kind of barriers that they experience. Thank you.
So, buenos días a todos. Aquí estamos con el DC Health, el Departamento de Salud del Distrito, y el mayor de Educación del Distrito de Columbia, de la oficina de Mayor Bowser del Distrito de Columbia. Les queríamos enfatizar de que es muy importante que nos coloquemos las vacunas a nuestros hijos, a nuestra familia. Las vacunas son seguras, las vacunas salvan vidas, las vacunas previenen enfermedades serias y hasta han eliminado enfermedades del mundo. Así que hacemos un llamado porque el gobierno del distrito va a requerir que nos vacunemos de todas las vacunas aprobadas por el FDA. Como hemos visto, son las rutinarias que siempre nos hemos puesto, más las del COVID-19 de 12 años para arriba. Los de antes, de 6 meses para 11 años, está todavía en uso de emergencia. Es muy importante que nos acordemos que si estamos vacunados, vamos a hacer un buen año académico, vamos a seguir creciendo y estando saludables, y esto nos va a permitir no fallar de ir a la escuela y perder días de clases, perder momentos de crecimiento personal. Hacemos un llamado a la comunidad de que es muy importante que nos coloquemos las vacunas, porque si no tienen las vacunas no van a tener escuela hasta que se coloquen las vacunas y demuestren la prueba de que las tienen. Es muy importante que se acuerden que las vacunas el gobierno ha hecho que sea accesible en muchas formas, no tienen costo en este momento, así que queremos hacer un llamado a la comunidad, independientemente de su situación de seguro. Ustedes van a tener las vacunas porque sus hijos tienen que seguir yendo a la escuela, y el gobierno está comprometiéndose para que esto pase así, porque queremos llegar a más del 95% de los niños vacunados.
Anything else? Okay. Thank you very much.